Hi, I am Dr. Shrutika Vasudeva, and I work at Ryder Hill and Johnson. A common question that gets asked is what makes a pregnancy high risk? Now, whether planning for anticipating the birth of your baby, every woman hopes for an uneventful pregnancy, of course, and an easy delivery. For most, that's exactly what happens. However, women can face unexpected difficulties and complications. So, what makes a high risk pregnancy high risk? It is one that typically certain risk factors can play. So, such as if you have a history of pre-existing diabetes, perhaps a chronic high blood pressure, history of blood clots, rheumatoid arthritis, other autoimmune diseases, any kind of heart disease, or any long-standing infectious diseases such as HIV, hepatitis. Also, if you have current or previous history of cancer, and especially psychiatric disease. One thing that people forget to realize is sometimes being on medications that are generally safe, but also cautioned in pregnancy can also make you high risk because they could have fetal effects. Fetal risk factors that can make a pregnancy high risk, of course, birth defects, chromosomal problems, genetic syndromes such as Fragile X syndrome, cystic fibrosis, again, other inherited diseases as well. And then things like high risk that come along the way in pregnancy are fetal growth restriction, which basically means that the baby's measuring small during the course of your pregnancy, and fetal anemia. Now, there's also pregnancy-related risk factors that can complicate a pregnancy. So, a history of multiple miscarriages or pregnancy losses, stillbirth, preeclampsia and HELLP syndrome, placental abruption, perhaps a history of preterm labor or preterm premature rupture of membranes, whether you have too much amniotic fluid or too little amniotic fluid, and then, of course, if you're carrying multi-fetal gestations, which is twins or triplets, that can also, of course, make you high risk. Please do come and see me if you want to discuss any of these matters in detail.